If you have been told you have a torn meniscus, you're likely facing a difficult choice: surgery or rehab. Let's talk about how to make the right call. I'm Dr. Sean Leo, your friendly orthopedic surgeon. My priority is to help you protect your joints for the long run. Your meniscus is like a cushion inside the knee. Once it tears, it doesn't always heal by itself. The treatment depends on where and how severe the tear is. Tears in the outer zone of the meniscus sometimes respond well to physiotherapy because that's the area that has better blood supply. Tears towards the inner aspect, also known as a red-white zone, usually don't heal on their own since there's little or no blood supply. These often need surgical repairs. Another big red flag is if your knee locks or catches. That usually means the tear is unstable. The biggest danger is waiting. An untreated tear can fray further, damaging your cartilage and speeding up arthritis. When surgical intervention is the most effective solution, we can address the specific tear with a minimally invasive day surgery, preserving more of your natural joint. It's not about guessing, it's about getting the right diagnosis and treatment plan early. Your joint health is a journey, not a destination. Take a confident step forward.